And welcome back to the show. According to the American Heart Association, almost 50% of American adults suffer from elevated blood pressure, which is a major contributor for heart disease as well as stroke. Now, shockingly, just only 30% of adults in the United States have discussed the potential impact of the common over the counter pain relievers on their blood pressure with their healthcare providers. Now, joining me now to share a little bit more is the Chief Clinical Science Officer at the American Heart Association. We're pleased to be joined by Dr. Mitch Elkind. And we thank you so much, Dr. Elkind, for being with us.
Well, thank you, Darren, for having me and the Heart Association on your show today. Appreciate it.
Yeah, I want to get at this here because when we talk about over the counter, it's pretty common. Everybody goes to get over the counter medicine, and we think it's just the right thing to do sometimes. But the reality is that when we talk about over the counter medicine and you're dealing with high blood pressure and things such as that nature, it's always important to really consult a physician.
Yeah, that's absolutely right. I think we have this idea that if you can get it over the counter, it's not going to have any adverse effects. But that's not entirely true. And especially for people with high blood pressure, those medications can raise the blood pressure further and in some cases to dangerous levels. And so we really want people to know about it because there may be alternatives to those medications that they can choose, and good to discuss that with their primary doctor.
And also, if you have pre-existing conditions, I think that's also something that really has to, come into factor here too.
Absolutely. Heart disease, a history of stroke, blood vessel disease in other parts of the body similarly can be an issue. And so for sure, you want to check that out with your doctor and measure the blood pressure regularly. So these days, people can get home blood pressure monitors that are validated, that are accurate, and that way you can check your blood pressure at home. And if it starts to go up, then take action, call the doctor, change behavior as needed to try to bring it back down.
You touched upon these devices here, and I think they're very critical, right? When people are sometimes prescribed and told to get it, or they feel like they want to get one themselves, the home blood pressure device, how valuable a tool is that?
Very valuable. So a lot of work that the Heart Association has seen recently and that we've published on has indicated that when people monitor their blood pressure at home, they get a better estimate of what their blood pressure is over the course of a day. Your blood pressure changes with lots of different activities. That information is useful for the doctor in adjusting the dose and sometimes the timing of somebody's medications. So those are useful. There are lots of devices out there, though, and so there's actually a website called validatebp.org where you can look up which devices are really the best to use, because you want to get good information, not just any information.
Yeah. The older we get, the more we've got some challenges in life. The body just doesn't operate the same way that it used to. And then we find ourselves trying to sometimes self-medicate. And one of those things we do, we use aspirin, pain relievers. But talk to us about those things pretty much. And I'll stick more closer to pain relievers. How does it affect one's blood pressure and the potential outcomes there?
Yeah. So the pain medications that you can get over the counter that are most concerning for us are what we call the NSAIDs, NSAID. That's non-steroidal anti-inflammatory drugs, and they're medications like ibuprofen, naproxen, and others in that family. And even aspirin, frankly, can fall into that category as well. And so they can, especially if you use a lot of them or use them over a long period of time, they can affect the kidneys and lead to increases in blood pressure through that mechanism. And there may be alternatives like acetaminophen, which may be a safer bet for some people. But again, best to talk to your doctor about that. And then there are the cold remedies as well, which can have stimulants in them that can directly raise the blood pressure. And so alternatives there are cold remedies that don't have those stimulants in them. And people can look at the packages. Some say, this is okay for people with blood pressure, this is not. And so you can actually see which ones may be right for you. And if you have any questions, of course, you talk to your doctor about that.
Yeah, you're leaning into something, which is warning signs, symptoms. What are things that I should be paying attention to really get myself in the right kind of direction, Dr. Elkin?
So most of the time, the impact on blood pressure of these medications is pretty modest. So people wouldn't notice a change in symptoms because, again, it's important to know your numbers. And that's where these home monitors, for example, come in handy, or getting your blood pressure checked in the neighborhood pharmacy or a gym. So keeping an eye on it can be helpful. But there are some instances where the blood pressure does get so high, that people can have symptoms. And the symptoms to look out for in those cases would be headaches, blurred vision, dizziness, lightheadedness, even chest pain, because the heart has to pump so hard against that elevated blood pressure, it puts strain on the heart. So if those things are happening, if you're experiencing, those kinds of symptoms, headaches, chest pain, then for sure you need to get checked out immediately. It really is considered an emergency because it can lead to stroke very quickly. So that's what I would say. Get it checked out if you have those symptoms.
And I think the message is really like to be proactive rather than reactive, right? And I think that so many times people are pretty reactive, but the reality is we want to see people on the proactive side.
100%. We put it off and we put it off, we put it off. So that's why getting control of your health, knowing your numbers, figuring out a plan with the doctor, keeping a log of blood pressures that you can show the doctor, or these days with the home monitoring devices, many of them will allow you to send the information to the doctor. It can be even put directly into the electronic health record, and people can, and the doctor can access it there. So, these are ways to try to stay on top of it.
Yeah. And what are some of the common mistakes that you think people are making during this season when it comes to this?
Well, we know that there are a number of what we call behavioral things people can do to control their blood pressure. Eating a healthy diet, less sodium in the diet. We advise for a Mediterranean style diet, or what we say is a DASH diet, which is low in sodium. That's dietary approaches to stop hypertension. So those are good diet patterns. Getting enough physical activity, even walking is very good for the heart and lets people live longer. So we recommend 30 minutes 5 times a week, 150 minutes a week of moderate, at least, activity. Limiting alcohol intake as well. Alcohol can increase the blood pressure. Obviously, we're coming into holiday season, not quite yet, but I guess we'll have Thanksgiving this month now. So those are things, the holidays is a time where we tend to let down our guard. We drink more, we're going to parties, we're eating less healthy, maybe not getting as much exercise, especially in, areas where it's a little colder, like here in New York. So I think, those are the challenges that we face this time of year. And so being kind of doubling down on those, being mindful of our health is really important.
Yeah. Well, Dr. Elkind, I want to thank you so much for taking the time of being with us. Much needed advice, and hopefully people will heed to it. And we thank you so much. He is the Chief Clinical Science Officer at the American Heart Association. And we thank Dr. Elkind for being here with us. And so want to let you know, thank you, Dr. Elkind.
Thank you so much, Daren. And people can find more info at heart.org.
All righty. Well, I want to let you know, too, if you want more information, please visit them at their website at heart.org, and then also call them 1-800-AHA-USA-1. 1-800-AHA-USA-1. And we'll be right back right after this.